We will have Dave Gehm. He is the president and CEO of Wellspring Lutheran Services, and he'll be joined by Dalton Herbal of LeadingAge. Thank you both for being here today. We welcome you and look forward to hearing your testimony.
So it's a pleasure to be here with you today, and appreciate Chairperson Colley the opportunity. Really what you've done here today, maybe for the first time in almost a year, is you've given voice to the voiceless that have been isolated and locked away for 11 months. The public square finally is hearing that voice. So thank you for that. I've submitted written testimony, so I'm going to abbreviate my remarks and hit some highlights, if I may. The powerful stories that you just heard sort of speak for themselves, and so I don't want to get into that. I will say this: that when this began, we had very little with which to fight the virus. We knew it was deadly for seniors. We knew that our seniors living in care facilities had all the wrong checks on their check boxes in terms of comorbidities and medical complications, and so we had very little to fight with. And so initially, restrictions on visitations, lockdowns, if you will, made sense because we had to do something, and so that's what we did. But things have changed, and we've seen changes in case counts, we've seen changes in mortality, we've seen additions to our arsenal, which I'll talk about in a minute. But as the initial surge of cases began to dissipate in the spring, the Centers for Medicare and Medicaid Services out of Washington published some guidance around opening nursing homes and congregate care facilities again for visitation, a phased program. And it would be based on community positivity rates at the county level. And when that came out in May, we were very excited about that opportunity as summer was approaching. That it seemed to be an opportunity, and our residents were very excited. Under those CMS guidelines, indoor restrictions could begin to be lifted when county positivity rates got into the 5 to 10% range. If they were above 10%, no visits, and then eased even further when county positivity rates got below 5%. And so that made a lot of sense to us, and we were excited about that. However, unfortunately, the state of Michigan did not adopt or otherwise sort of take up that guidance, and instead developed a 5-tiered system of A to E using an algorithm that was put together with the state of Michigan, working with the University of Michigan School of Public Health. And so there are 5 levels within that, and frankly, it's been quite confusing because we still have counties at an E level in Michigan, which means no visitation, that are running consistently below 5% positivity. And so the sad fact is that we've got essentially, with some change, but not substantive change, we've essentially got the same visitation restrictions that we had on March 13th of 2020, despite so much being changed. A couple of examples, if I may. As of last week, when I dug this information out to have it fresh, if we had implemented the CMS guidelines in Michigan, there would have been only 2 counties unable to open for visitation in some form. Instead, applying the Michigan approach, we actually have 38 counties that have no opportunity for visitation under that approach. A couple of specific instances that continue to add to the confusion for us. Ionia County is currently, as of last week, was at a 10.1 positivity rate. Saginaw County was at a 3.3. Both appear on the My Safe Start map as being level D, meaning being open for very restricted but some visits. According to or applying the CMS guidelines, Ionia Nursing Home visitation would be restricted completely, and the Saginaw County would be open at the most generous level at that point. And finally, of interest, Lenawee County, as of last week, was at a 4% positivity rate, yet shows up as a level E on the My Safe Start map, meaning no visits. So these are important examples to make the case that we need a more local, nuanced approach to opening visits for folks. And I would just point out that we are now at a different stage of this pandemic, very different than March 10th when it all began for us. We have adequate PPE now. We have weekly and biweekly lab testing of residents and staff as needed. We do have rapid tests at the door. We have therapeutics and monoclonal antibodies that we did not have, and frankly, that have been proven to be quite effective in the senior population. And of course, we have vaccines, and nursing home and assisted living residents in Michigan have been vaccinated at around a 90% uptake level. So that's significant. So I'll just conclude by saying this, that restrictions that have been placed upon all of us, when we look back on this, we will look at it as a difficult time and a time in which we lost things. We missed events, we didn't make memories, but we'll look back at it as a moment in our lifetime. For our seniors, this is not a moment in their life. This is in fact the rest of their life. And the failure to thrive that we're seeing from isolation, from loneliness, is really tied to the fact that even when we're frail, even when we're sick, we have a life purpose. And when you're old and frail and living in a nursing home or assisted living, your life purpose is linked to your family and those that love you. And when we've cut folks off now for 11 months and not given them that opportunity to see their loved ones, they're giving up because they've lost purpose. And those in the field, those of us who've been in and out of these facilities all these months, can tell you that there's a statistic we keep of those who have died of COVID. We have to be careful about the statistic of people who are dying from the effects of COVID. And we have an opportunity to change visitation, to open it up, and to get people back to their loved ones in a way that is safe and effective and can be done. We've seen it in other states. We can do it here. Thank you.
Thank you very, very much for your heartfelt testimony. We appreciate your expertise, your understanding of the issue, your clear desire to make sure residents are safe, but your understanding of the other health impacts that are occurring and that there can be a better way. These stories we heard today are evidence of that. Thank you so much. I do have several questions. First is Representative Whiteford.
Thank you, Madam Chair, and thank you for your testimony today. I'm curious, how far off base are we from other states? And is there a state that we could be modeling that would be more person-centered to where we're at in this pandemic?
Yeah, that's a great question. Thank you. I would point us to Indiana and Minnesota, both of which have essentially adopted the CMS guidance that was put out in May with some local adaptation. But have put together a very robust and very effective way for families to be seeing their loved ones and have been doing so successfully really throughout the summer. My sense is, I don't know those cases exactly, I pay attention to them. My sense is that when the surge came this winter, you know, they shut back down a little bit, but they're back open again.
Thank you. That's very insightful. We all want to learn and do the best and right thing when it comes to these policies. And next we have a question from Representative Morse.
Thank you, Chair. So you were talking about the Safe Start map and the issues with that. And so you talked about specifically the positivity rates. So I'm wondering, in your experience, or if you know this, you may not know this. So the other requirements, is it an issue of they're continuing to have maybe one positive case pop up so they don't meet that 14-day threshold? Or is it that they haven't experienced a decline of at least 14 days? Because those are both some of the other requirements. Yeah. Do you know? Yeah. Do you know that?
So on the first instance you're raising with respect to maybe a case popping up, as was described by one of the other testimonies, a case popping up and then you have to shut it back down for 14 days. I don't think that gets into the algorithm. It's not a data point that's put in there. Decline in the county is and is followed accordingly. But positivity and the spread in the community are the big issues that are driving nursing home cases and so forth. And I think the biggest issue for us to just keep in mind is we've got 90+% of these residents now vaccinated. That is 95% effective. We also know that even if that 5% window that's open that creates an infection, we know from the science now that folks who get it after being vaccinated, they get far more mild cases and far fewer hospitalizations. And so there's a risk quotient here that we need to understand. And elders in these homes are certainly capable of participating in their own life choices around risk. We do it every day, and they should be able to do it too.
Thank you. Representative Beeler has a question.
Thank you, Madam Chair, and thank you for your testimony today. I think you said a lot that I agree with. I couldn't agree more on the local and nuanced approach, to use your term. My question is, we're putting so much on the metrics, which I think is important. We need to get to that point where metrics are what are driving our policies. In your opinion, and based on your experiences, do you think positivity test or positive test rate is the best way to summarize a situation in a given county? Is there another statistic that we should be using, or are we just using this because it's what we've been using?
Yeah, so a couple of things about that. I think we have to look at positivity rates. I think we have to look at infection rates in the county, as was mentioned a moment ago. But I also think we have to look at what we have in our arsenal to protect people, which when all of this was begun, we didn't have. And so when you layer on a dropping positivity rate below 5%, when you layer on the ability to test, even if it's not perfect, it's 80% or more perfect. When you identify that 90% of the older people in this building have been vaccinated, you start to reduce that risk profile. So you do have to look at multiple things. I don't think there's one metric to rule them all. Having said that, when you look at that package, we can do that. There are ways to think about that and still allow our elders to see their loved ones and do so safely. And again, I would point to the examples in other states, and I'd be happy to follow up with the chair and provide some of that background on that.
Thank you. Thank you for that information. We are very tight on time. I think we'll try to get 2 more questions in, and that would be Representative Pohutsky.
Thank you, Madam Chair. Thank you for your testimony, and thank you for the work that you've been doing. I agree with you. We are in a different place than we were in March, and I understand that, you know, the majority of seniors in these facilities have been vaccinated. In many cases, staff has, but for some clarity, my mother is a nurse in a nursing home. She's also 70 years old, has pre-existing health conditions. She has not been able to obtain a vaccine yet. And I know that varies county by county. We've struggled in Wayne County, that's no secret. But additionally, there are other staff that work in facilities that are not eligible to receive the vaccine yet. And I'm certainly not negating the health impacts that this has on seniors who live in these homes. But I want to make sure that we are not forgetting that there are other people who may contract COVID because of, you know, changing some of these policies. So I guess just protocols in place for people who may not, you know, custodial staff, things like that, people who work in these facilities but may not be vaccinated yet. You know, are they being taken into consideration as well when we talk about amending some of these policies? I agree changes can be made. I just don't want to leave people out of the conversation who may be impacted by these changes.
Yeah, I'd be interested in facilities that weren't able to get vaccinations for any and all folks. In our case, in case of our colleague facilities at LeadingAge, for instance, we know that we were able to get vaccines for anybody who had regular business in that facility. That included custodians, that included our dietary staff. Even if they didn't have direct patient contact, we've offered vaccines now all through 3 clinics in almost all those facilities. Having said that, for those who, for whatever reason, didn't take it, we still continue with weekly or biweekly testing using lab tests that are far more accurate than the rapid tests at the door. And so we do that, and that's a great screening tool for us. We continue with full PPE, we continue with all the hand washing, all the social distancing. And so that's all in place. And I think the evidence of that working is we're seeing significant declines in these facilities after vaccines have come through. And so, the data is still forming on that because we're still in that process. But the vast majority of Michigan nursing home and assisted living residents and their staffs have had the opportunity to take the vaccine by now.
Great, thank you.
Thank you. And our final question, and then we will close committee. Representative Alexander.
Thank you, Madam Chair. First of all, your first witness that was on virtual, I would ask that they could provide us with some information. They made the statement that not only did the county medical care facility organization, but 2 other entities reach out to the governor and offer insight. I'd be curious as to what that response was. Second of all, to you at the table, thank you very much for your testimony. So what I heard you to say is last May, the Centers for Medicare and Medicaid Services, CMS, published new guidelines on the relaxation of visitation restrictions for care facilities. In your document here, the state of Michigan did not adopt or otherwise take action to implement these plans or policies, thus leaving us at the same place we started with in last March, versus having new plans and policies in place for our loved ones to have time with their families. My question for you is this. When you've reached out, when you've asked the state of Michigan to implement a common sense policy, such as you have presented, such as that is being presented at a federal level, what kind of response are you getting into their willingness to have this conversation and modification?
So there's been ongoing dialogues at almost every level to have that conversation. I would say that we have been listened to but not heard, and I think that I think this sort of hearing, this sort of public square conversation is exactly what's necessary. There are. I don't question motives. I don't question, intent. All I know from the front lines of this is that things are different and we can do better.
Thank you.